Hi everyone, and welcome to week 3 of my breast cancer vlog. I'm Liz O'Riordan. I'm a breast surgeon who's had breast cancer 3 times now. Once in 2015 and then 2 local recurrences. And this is week 3 of my treatment update. And there's a lot to go over this week. So I left you last week where I got the results of my biopsy telling me that it was a lobular cancer that had come back and I was waiting to have surgery. And my skin had been pulled pretty tight before with my previous local recurrence and radiotherapy, but my surgeon thought that she would be able to get the cancer out. And it's weird walking into a hospital where I've worked as a doctor, onto a ward where I worked as a doctor, where nurses recognise me in the role of a patient. And it felt weird. I think I was recognised by a couple of the women in the same ward as me because of who I am. But I'd taken my knitting with me. I was knitting a black camisole vest for the summer that'd probably be ready next year, knowing me. And I was furiously knitting away, just trying to keep myself calm for the surgery. My surgeon came to see me first thing and said I was first on the list, which was a lovely relief because it meant I would definitely be going home later that day. And she drew on me and she talked about what she was going to do. And then I saw the anaesthetist, who was lovely. I'd worked with her before and she just put my mind at ease. And all too soon, I was on my way to theatre. I actually thought I was going to be operated on at the end of the day and my husband was away for work, planning to come back, but he was in another town and it meant I was going to theatre by myself without having said goodbye. And that was really hard because he's been there at the beginning of every operation and I had to be very brave and go through by myself. And the team were lovely, and I was in my gown with my knickers on and I went through into the operating table and I was lying there surrounded by everybody. And I remember just chatting away about how I was feeling, and then this wave of grief bubbled up and I thought, I'm going to cry, I really, really miss Mum, and then I was out for the count. But before I went down to theatre, I did something a bit silly. So back in 2018, when I had my first recurrence, there was a thing going around on Twitter where doctors were putting little sticky googly eyes on light bulbs and cupboard doors just to make people laugh on a Friday. And I thought, I did this when I had my ovaries out. I put 2 googly eyes above my belly button to make my gynecologist laugh. And I did it this time to make my surgeon laugh. So I put 2 googly eyes above the little nodule to make her laugh when she took me to theatre. And I woke up a few hours later and I was pain-free. Now my skin was numb from having had a mastectomy before because it desensitizes all the skin, but I wasn't in any pain. And a couple of hours later, my husband arrived and I was home. And it still all felt a bit surreal. I couldn't imagine that my breast cancer had come back and now it had been removed and I was technically cancer-free again. But I got this scar with a big bandage so I couldn't shower for a week and it was really, really hot that week and I was trying to move around in the shower and not get it wet. I couldn't go swimming. It's really hard. But the week after surgery, we went to Italy with my husband's family and it was mostly lovely. There were lots of kids there. There were a couple of tantrums, but it was nice just to be able to sit and read. And I read so many amazing books. I read Tomorrow, 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 which I loved, and The Phone Box at the End of the World, which is just the most beautiful story about how people in Japan learned to grieve following the tsunami, and I can really, really recommend it. But I was still a bit nervous inside, wondering about what future treatment I'd have. And this is where I'm your worst patient because I'm a doctor, I'm a breast surgeon, I know how to search, I know what I'm looking for. I thought I knew what treatment I wanted, but would my oncologist give it to me? Whilst trying to be calm and sensible and not tell her what to do, it was really, really hard going into that room and being sat back in the oncology waiting room. God, took me right back to 2015 when I was waiting to have chemo, and it kind of dawned on me, this is real. I have had cancer 3 times and it could come back and I might need treatment for the rest of my life. And it was like, oh God. My oncologist was lovely. And the first thing she told me, no, I've skipped a bit, rewind. I had to go back to get my results. Yes, that's right. After the holiday, I went to see my surgeon to get my results and she told me it was all out. It was only 8 millimeters, so a tiny little thing. It was the same lobular cancer as before, ER positive and HER2 negative. And she said that I would be seeing my oncologist in a week to find out what further treatment I had. That's right. So I had a week of trying to keep busy, but again, like before, my brain couldn't focus. I wasn't sleeping until 3 or 4 o'clock in the morning, just this low level anxiety of worrying and what if and how and what, and just another week where I just had to write everything off because I just couldn't focus. And although I knew what she was probably going to tell me, it's different when it actually becomes real. So there I am back in the oncology waiting room, and my oncologist called me through. My husband could come with me this time, and she was great. The first thing she said was that my cancer has a PIK3 or PIK3 mutation, which is actually really common. 40% of ER positive, HER2 negative breast cancers have it. Now, I'm not an expert on this at the moment, and it means different things depending on whether your breast cancer has it at the beginning or whether it's a mutation that you get later on. It does mean that your cancer may be more likely to become resistant to endocrine treatment in the future. That's all I know at the moment. But it also means that if I do get metastatic cancer, there are drugs available that do specifically target that mutation. So that was nice to know. I've got that in the back corner, I guess, if I ever need it. She wanted to talk about radiotherapy. Now, you can give radiotherapy twice, and I had it twice when I had my last local recurrence, covering this area on my chest wall where my cancer was, and she had a look. And it turns out that where this nodule is too close to the second field, and it'd be impossible to do it without causing overlap, and my heart had probably had too much radiotherapy anyway. So radiotherapy was off the table, and I was quite relieved about that, to be honest. My skin's pretty thin. It still got damaged from the first round of radiotherapy, and I really didn't want to go through it again. So that was a big relief. But then she told me what I knew she was going to do. And it's that I'm going to be on treatment for the rest of my life until I die or my breast cancer comes back. And the problem is, because a second local recurrence is even rarer than a first local recurrence, there are no trials, there are no big data sets, there aren't many people to compare because everybody's cancer is so different. So a lot of this is guesswork, best practice, what you think you need. Now, there's only been one trial really done in local recurrence to see if giving chemotherapy again is a benefit. It's called the CALOR trial, and that said, yes, there is a benefit in people who are ER negative. But if you're ER positive, there's no survival benefit in giving chemo. So chemo was off the table. Now, I've been treated on tamoxifen, and then I was put on letrozole, swapped to anastrozole because I got carpal tunnel syndrome. So I'm running out of hormonal options. And she said there are two. One is to put me on the steroidal aromatase inhibitor, exemestane, but that's often used with a treatment for metastatic cancer. And she kind of wanted to keep that again in the back pocket in case I needed it in the future. So what she wanted to do to stop my body producing estrogen is put me on something completely different, which is called fulvestrant or Faslodex. And I'll do another video on that later. It just works in a different way by blocking estrogen receptors on cancer cells. Oh, there's someone at the door. That's the doorbell. I'm going to come back to this. Right, I'm back. It was a birthday present. I'm not meant to look at the parcels, so I tried not to see who it's from because my husband is ordering parcels and I'm home alone, and now the dog is very excited. But I digress. So, Faslodex. So Faslodex works by, as I said, stopping estrogen receptors attaching to estrogen in a different way to tamoxifen, but it's not a tablet. You have it as an injection, one injection in each bum cheek, and you have it at, say, day 0, and then 2 weeks later, and then 2 weeks after that, and then you have it every month for life. And I was a bit worried about how painful it might be and what it might be like and what the side effects were, but I kind of knew that was coming. The next thing she said was she wanted to start me on a CDK inhibitor. And I've done a video about the CDK inhibitors here, and I'll tag that at the end as well. So these are a new drug that work by stopping breast cancer cells that are growing really quickly. And it's now given to women with a high risk of recurrence in the beginning, like I was 2015, to stop it coming back. And it's given to women with metastatic or stage 4 breast cancer to delay the progression. Now, she was fairly certain that she could get approval for me to have it because I'm not primary and I'm not metastatic, I'm in the middle, but she wanted to put me on it. So that means I'm going to be on a CDK inhibitor for the rest of my life, treating me as if I had stage 4 breast cancer, and if my cancer does come back, we'll change options. And that was quite a lot to take in because I've had an 8mm nodule that's been fully excised and I'm cancer free. But I'm going to be on treatment for the rest of my life, and that means every month I will go to the oncology unit to have an injection in my bum, and every month I will have blood tests, sometimes twice a month, to make sure that my blood count isn't dropping. There are risks of some quite serious side effects with these drugs, although not everybody gets them. I can never eat or drink grapefruit again, and I really like pink grapefruit juice, but that interferes with the drugs, so that's off the table. And I was left feeling not a sense of impending doom, but my life is now going to be measured in monthly cycles like it was during chemo. But that was only 5 months. Although I shouldn't feel anywhere near as bad as I did during chemo, it suddenly means planning my calendar. Can I get the start date of my injections and tablets to fit in with the holidays I've got? Because 1 week in every month, my white blood counts are going to be really, really low. So there's a risk of me getting an infection. And it was the realization of how much I might have to unpick. And yes, I am so grateful that I don't have stage 4 breast cancer, but it's still a massive impact on my life. And in the weeks leading to see my oncologist and waiting to start the tablets, and that'll be next week's vlog, I had a couple of events to go to. I was talking at the wonderful Future Dreams House in London. They've just started a support group for people who've had a local recurrence. And I agreed to do it before I knew I had a local recurrence. And I was going along there as like the expert, but I was also a patient. And it was a privilege to be able to hear the stories of the women there who were sharing their lives and what had happened to them. But it was really hard as a patient trying to put my feelings down so I could give them what they needed from me as an expert doctor. And then local recurrence hit the news again when Linda Evangelista opened up about her breast cancer diagnosis. And again, I did a quick video on that here. It turns out that she had a bilateral mastectomy in 2018 and went flat. But last year she had a local recurrence. She noticed a bump on her chest wall. Although the press sometimes described it as a cancer of the pectoral muscle, it's not. It's just breast cancer cells sitting on top of the breast muscle where the breast breast cancer cells sitting on top of the fascia that sits on top of your pectoral muscle. So it's not a cancer of the muscle. But it made me realise that when I was a breast surgeon, I never really told women to check their breasts after a mastectomy to look for a local recurrence. We give them a pile of leaflets. You assume that something is in there that will tell them how to do it. I never did. Mine came up really quickly. So one of the reasons I want to talk about this is to say if you have had breast cancer, it is important that every month or so you do look at your skin from the collarbone all the way down to the bottom of where the breast should be. Look for anything new or different or a change, because it could be your breast cancer coming back. Now I've got a crib sheet here because so much has happened. Yes, one thing I wanted to talk about that's really, really important is if you've had breast cancer, invasive breast cancer, you will have had the lymph nodes in your armpits removed, and you get given a set of shoulder exercises, either the exercises on the Breast Cancer Now or breastcancer.org website, or your hospital may have some, and you're meant to do the pudding stirring and lift your arm up. And a lot of us do it for the first couple of weeks and then forget because life moves on. And it's actually really common to get a stiff shoulder, a frozen shoulder after breast cancer surgery. Not a lot of physios know how to help, especially if you have cording. And I had a frozen shoulder and my shoulder was being pulled forward due to the contraction of my skin and scarring from my last local recurrence. But the lovely Angela Jiggins, who's a new Macmillan physiotherapist at West Suffolk Hospital, is now in place to help anyone with cancer, but especially breast cancer patients. And my surgeon referred me to her. And I'm not going to lie, I don't always love her. But what she's done is just give me some really intense physio just to try and get the scar tissue moving and the shoulder moving and open up my arm. And even within 2 weeks, I've already noticed a difference. I couldn't get my arm back that far a couple of weeks ago. So if you've been treated near West Suffolk and you've got shoulder stiffness, ask your breast care nurse to refer you to her because she's amazing. But even if you're not near West Suffolk and you've got a sore shoulder, it's worth asking your breast care nurse, can you be referred back to a physiotherapist just to try and get your shoulder moving again? It's been quite a couple of weeks, and now I'm anxiously nervous about starting the treatment and finding out what the side effects will be like and just seeing what the rest of my life is going to be. But I've been to the gym because I know exercise can reduce the risk of it coming back, but it makes me feel good. It makes me forget I have cancer for an hour or so, and it'll help with all the side effects if I get any. So I hope you found this useful. Sorry about the blip in the middle with the doorbell going and the dog barking. If you've got any questions about breast cancer, let me know in the comments and I'll get back to you. Thanks for watching.